Welcome to another episode of Wild and Well. Today I'm talking to integrative psychiatrist and brain health expert, Dr. Hector Rodriguez, about so many things, but particularly his holistic approach to resilience and mental wellness. So, welcome, Dr. Hector. Thank you for coming on the podcast. But before we get into all that, can you tell us one thing that you've done for yourself to take care of you today?
Today, that's a good way. That's a good start. Actually, I got my hair cut. And I try to do that every Monday. But it also becomes like kind of like my start of my day, like get a haircut. I hang out pretty much all morning. Well, I work out in the morning, but then I hang out with my dogs a little bit in the morning. So like between the my haircut and the gym, I just hang out with my dogs. We go outside. The only problem was that today was a little bit like grayish. So now all their little paws are wet. And there's like little paws all over the house, but hey, whatever.
That can be cute. Yeah. Depends on your perspective, right?
Exactly. Yeah.
So can you share with the listeners like about you and what it is that you do?
So basically as an integrative psychiatrist, I try to tell people like, I work with the person's soul. And it kind of takes me back to like what the word psychiatry means in the first place, which is the medical treatment of the soul. When I learned that, I took that to heart and I kind of created the clinic around that being its main focus. Which if once you start looking at like, whoa, like I'm taking care of someone's soul, or we're gonna start venturing into like taking care of those wounds in your soul that are still hurting, that are keeping us stuck maybe in life. It really just changes the whole perspective of how we do psychiatry at our clinic. So it's like, when I'm working with someone, one of the first things I try to get to understand is like, okay, well, who are you? What is it that you're struggling with right now? But don't tell me a diagnosis. Like, don't tell me, oh, I'm struggling with anxiety. Well, no, what is it that you're really struggling with, right? And if the person can't really answer that question, then I gotta go to my next question, which is, well, where do you want to be? Where in life do you want to go to next? Um, because when I put together a treatment plan, it includes different other players that might come in and out of the picture as I guide the patient through kind of healing their soul, their mind, and what is it that, where they want to go. So that's kind of, in a nutshell, what I do. Obviously, the big one is working with individuals who are living in chronic stress or in high stressful jobs, situations, managing life changes. Those are one of the areas that I'm very passionate about. I think when a lot of us go through major life changes, whether they're good, whether they were planned or not, they can still kind of shake us up. And not everyone can go through them smoothly. So that's when I come in and I help them and I guide them in that process.
And your approaches look so vastly different to what we think of as conventional psychiatry, right? Can you like explain a little bit about like, I mean, you were telling us there a lot about your approach, but how does that differ from what people might typically think of or experience when they see a psychiatrist?
Well, I think as simple as like the first thing we were taught in residency is finding out the patient's complaint, right? But a complaint, we can complain about certain things or have certain complaints different on a day to day, right? So if I see someone today and they're like, oh, I'm coming with a complaint of poor sleep, right? Or I'm coming with a complaint of like, I'm dealing with this divorce and I'm struggling with this change that is going on, right? It changes the way we define what the issue is that we want to help, and then where we're going to go, right? So what is the path that is going to get us to resolution or that internal resolution of this struggle, right? Where traditional psychiatry is like, well, what are we struggling with? I'm struggling with anxiety. Oh, okay. So then this is what I'm going to do. We're going to give you this medication. We're going to do this type of therapy. We're going to do this kind of thing. Where if I'm focusing on the struggle that the person is dealing with, my job as a psychiatrist is to give them all the tools that I think will be best fit for them. So it also becomes very individualized approach. as opposed to, you know, just here, take this or do that, and that's going to help you with this or that. No, like let's go to more focused on the person, but then even more focused on the root cause. Like, what is it that got us here? Why is it that your brain, your mind cannot do well with change, for example? Or why is it that every time something occurs to you, there's a big hit to your confidence? So we got to build your confidence because, like I always tell my patients, life is complicated, life is not easy, but we're always going to be hit with stressors. I mean, life is a big ball of stress, right? But it's how do we navigate in and out or around them or through them that we can succeed in that thing that we call life, right? So my job is to be able to identify causes. I'm a big believer of looking for the cause, looking for patterns where I might see, hey, I think we're not having a depression issue, we're having a confidence issue. And because every time something hits, your mind automatically goes to like worst case scenario. Well, you've kind of been trained throughout life so far to go there because we have low confidence. So we got to work on the confidence. We might have to work on the discipline because we don't finish or follow through on things because we have bad discipline. And my skills in that area are just really weak because no one really taught me how. So that, when I work on that area, it really just puts it more one in the person's lap to say, hey, we're going to do this together, but I'm not just going to come in and save you every time. No, I want you to learn to do that for yourself. No matter what stress comes at you. That's, I think, one of the biggest differences in how I like to practice psychiatry. Do I have many tools in my toolbox? Is what I tell them. I'm like, yeah, I do. Sometimes we take one tool, which is called medication, and then sometimes we put it away because we don't need it anymore. But then now we need to target your nutrition because it's crappy. So it's like, okay, well, let's improve that. So all these things at the end of the day is to kind of fuel our brain to function better so then you can navigate life stressors.
Yeah, I love that approach. It just makes so much sense, doesn't it? And it's really a lot more empowering and getting the patient or the client to be part of it rather than like, I'm just
Mhm.
going to write you the
Mhm.
script and take this and I'm the all knowing what to do. It's like they're part of it with you,
Yeah,
actually building that discipline, like in that example, and doing the things that they need to do to shift their
Mhm.
life rather than just reduce a symptom.
Right.
Yeah,
Because
I
it
love
kind of takes us back to how we've been treating pain, for example, for decades, right? So I want to alleviate pain, and in this case, I'm referring to like physical pain. Well, here, take this opioid to alleviate pain. Well, but look what that has created. So it's like, okay, how do I then navigate emotional pain, which is what I call those emotional wounds in our soul, right? How do I learn to not just take away the pain, doc? I don't want to feel that pain. Well, yeah, nobody likes pain. However, we've all learned that through pain, we build resilience. So it's like, okay, what are things that I can reduce? But more importantly, what are things that I can teach you so then once you face painful situations, it doesn't affect you, or it doesn't affect you as much as it probably did before because we were just weaker. And that's the same thing we do when we put stress on the body when we exercise. And that's the way that I kind of teach my patients sometimes. Like, listen, if I right now give you to bench press, I don't know, 900 pounds, you're going to break your legs. You're going to have injury. Well, then that's not appropriate. But we got to build because we have to build the strength on your legs. So how do we do that? By causing little micro stressors every time you go work out. I mean, we work out, it's a stress on the body, but that's how you build muscle and that's how you get stronger. So I try to get a lot of that, philosophy into what I'm doing when it comes to like building resilience. I have to give you the tools so then you can go a little further into that area that was painful, right? But it's okay. Feeling pain like that, small amount of pain is I need you to feel that. And I think right now we're living in a time where people just don't want to feel, right? That there's these negative views of certain feelings too. And I try to teach my patients like, you can't judge feelings. If you're feeling anger, you're feeling sadness, that's not a negative feeling. That's a feeling, And it's okay sometimes to feel anger, but what do you do with that anger is what I care about. Are you hurting yourself emotionally, physically, or whatever? Are you hurting other people emotionally, physically? Well, that's not the best way to deal with that kind of pain. So I try to give them all the tools that I've been able to gather, and at the same time, all the knowledge that I have when it comes to how the nervous system responds to these stressors. So then I can say, okay, let's go in a little bit further in this area because we're like, struggling.
It's such a good perspective. Like, I love your example of the gym. Like, because I think, yeah, we live in a time where, like you say, people don't want to feel anything that feels
Mhm.
uncomfortable or like their emotions.
Hmm.
And we can, in so many ways, feel comfortable. And we're almost stuck in this
Hmm.
epidemic of just being comfortable that
Be uncomfortable. Yeah.
we don't test ourselves and push ourselves to have those little micro injuries
Hmm.
to
Hmm.
build our strength in
Right.
our resilience and in our like psychological capacity. But it is critical because then life
Hmm.
does throw hard things at us. And if we don't
Yeah.
build up in those small moments, we're not going to be able to, in the
Mhm.
big moments, be able to cope, are we?
And it's okay sometimes to get life to tell me or to tell us like no, you're not gonna win in this or you're not gonna succeed in this. Okay, well, what can I do then to go around it? Or like, or if I really want this, and I think when we teach, and I think all of psychiatry, psychology has been teaching of, this thing of like not feeling or being in this perfect state of constant comfort, then we don't thrive for anything, which is scary. If you look at it, the big scheme of things, like if you have a generation that doesn't thrive for success or doesn't thrive to work hard and feel discomfort and feel pain to get to that next level, right? You get people that are just mediocre because they're accepting to just be where they're at. Or one of the things that I see a lot with my patients who have experience with trauma, like really bad trauma, is that they just stay chewing on that trauma and then they become identified by that trauma or that traumatic event. Like I can do this because I experienced this. And it's like, no, 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 no. Yes, you can. Oh, but I have this that is like keeping me. No, no, no. That is there. It occurred. We have to separate ourselves from that event so you can move forward. So you can say, I can do XYZ, you know? Um, so it's something that is happening that we need to change, like now, the way we're working with people, and not just my mom says this phrase in Spanish, pasarle la mano, which is like kind of when you're stroking a cat, like, but it's like kind of the idea of like, oh, it's gonna be okay, like you just like kind of let pet them and then like it's gonna be okay. If we just tell people it's gonna be okay and just kind of pet them, we're keeping them there, And I teach my patients like if you see me doing that to you, call me out on it because that's not what I want to do. I want to, yes, there's times for hugs and feel empowered and have someone on your side to tell you like it's going to be okay. But then that person also has to be like, but you can do it. It's going to be hard. I never said it was going to be easy. It's going to be hard, but we're going to do it together. You have me, and then we're going to have other people on our team to empower you, like for real empower you to move forward. But part of that empowerment is those micro stressors that are going to happen.
Yeah, it's about being like okay with where you are and working towards the thing or moving through the thing. Like it's both,
Right.
isn't it? Together. You
Yeah.
can't have
It's
one
it's
or the
a it's
other.
a little tug of war thing that has to occur.
Yeah.
But at the end of the day, it needs to keep us moving forward. You know what I mean? Like, the little tug of war has to keep us moving forward. So then you can say, "Oh, I can do that." Because look, last year I wasn't able to go through this time because this was a trauma anniversary for me. And look, I'm not triggered. I feel okay. Yeah, I had 1 or 2 nights of bad sleep because I remembered, but it wasn't like 2 or 3 weeks of hospitalization, of completely the decompensation. Like, no, that didn't happen this year. Wonderful. Let's celebrate that. So then we can keep moving forward.
And what are some strategies that you use to help people like process and move on from stressors, like even those like you call middle traumas?
hmm So when it comes to like the middle traumas, those are those big, those life stressors that we still didn't plan for. Let's say let's think of it like a divorce, right? Or some kind of loss that occurred. First, we got to identify that that's just what that is. That doesn't define you, right? You are not a victim of. And even though I hear people saying that, I always try to like get them to not say, like, don't identify yourself a victim of anything. No, you are you. This occurred to you, but you're not a victim of that, right? Or a survivor, because they'll try to change the word around, right? Oh, I'm a survivor of blah blah blah. Wonderful. But that's still like giving you identity. Don't identify yourself by that event, you know? Um, so first identifying that that's just what that is, right? It's an event, it occurred. Let's be able to put a plan in place to move forward, to succeed and come out of it and not keep dragging it along, right? The other thing I try to do is, well, let me look at how your nervous system has been rewired. Do you have a very sympathetic response, which is what we consider like a fight or flight kind of thing, right? Or do you have more of a response that is very like lethargic and apathetic and whatever, because I need to be reserving energy because everything just seems so hard to do and just draining, right? And we hear a lot of the word brain fog, right? And I just can't like I'm just I can't push through because I can't even like focus or I can't concentrate. I can't get things done, right? So I first start with those two areas to identify. So how is your nervous system responding? And the way that I do that is through several sessions of us identifying what are some of your signs and symptoms that let me know which nervous system is taking over, right? Because whether we had one traumatic event or a bunch of middle T traumas in life, your nervous systems kind of starts learning that this is how I can preserve myself. How do I stay on like, survival mode, right? Well, we got to get rid of that. We got to change that, right? So if it's a sympathetic response, I have to be able to give us nutritional plan, exercise plan, supplemental plan to kind of calm down the sympathetic response that is just way too activated, right? I've even gone to like today, I had two of my patients went and got a stellate ganglion block. So a stellate ganglion block, basically it responds to just kind of calming down that sympathetic response. And all my patients that I have recommended to get a stellate ganglion block, after the first block, they're like, oh, like I have this like feeling. And I'm like, I know because I had it done. I'm like, I know exactly. Remember, I told you. And I do that too. Like I'll go and like some of these things I go and I try it on myself. I film myself. I show my patients like, look, I did it. I did it myself. It's safe. I'm fine. I didn't die. Um, but right before we got on our call, two of my patients were calling me. They're like, oh my God, finally, like I know you've been like harassing me to get it done, and now I know why. And I'm like, good. So I'm also a big advocate for education. I educate my patients as much as I can and as much as they can handle, right? Because sometimes too much information kind of overwhelm someone. But I do like to educate so they can see that the reason why I want them to do X, Y, Z, it's for what I already taught them. So then it's awesome to hear that. Then they call me, they're like, oh my gosh, you were right. I feel so relaxed. This is incredible. Thank you so much. I'm like, good. Now we got to start working on the other things that I recommended us to do, right? So I go from something as invasive as a stellate ganglion block to taking a supplement like theanine or GABA on a regular basis, depending on where they're at and how their nervous system is responding. So those are some of the tools that I tend to use. Obviously, there's different kinds of psychotherapies, but for example, if someone has a very sympathetic tone, they won't respond to therapy because they'll even see the therapist as a threat because anybody is a threat. Even like for us who have better, nervous system regulation, we see therapy as like, oh, that's like a place for me to go and like release and have someone like hold my hand. People with a very sympathetic tone, they don't see therapy that way. They see it as, oh, here's another person that is kind of coming into my personal space. So they're already seeing them as a threat. So when I work with therapists, I'm like, let me get them ready. Like, give me like, I do want them to eventually go, but let me get them ready. Once they're ready, trust me, therapy will be so smooth, and all the things that you're going to be doing are going to be really effective, and you're going to see it right away. And then I also want you to be giving me feedback. So these are some of the things that I do in like in a nutshell so far that I can tell you, to see how we can get that nervous system back online and better regulated.
And how does that differ for the people who are more like fog and slower and conserving their energy? Like, what's your approach with them, and how does that differ from
That
those in sympathetic?
that one requires more activation.
Right.
So to kind of keep it a little bit more simple, like that one we would need to activate more. I focus a lot on pleasure, right? What are some things that can increase our pleasure? Because we have this anhedonic, and anybody that doesn't know what the word anhedonia is, the lack of pleasure, right? And people might say, oh, that's like the main symptom of major depressive disorder. Yeah, but anhedonia, you can see it in people who've experienced really big burdens in life because now they go into this lane of like, who cares? Why? Why do I bother? Right? So then I'm like, okay, we got to work on pleasure things that we can add into this person's life. So things like exercise is one of the first things that I have them do, but more specifically, high intensity interval training, because that has been shown in studies that that kind of exercise increases the most dopamine in our body. And dopamine is the best way to get that pleasure sensation, that feeling of accomplishment of like, whoa, like that felt amazing. Like I want to do that again. That's dopamine, right? But then if I see that their anhedonia or their lack of wanting more out of life is because of lack of connection, then I need to see, okay, what are some areas in their life that they don't have any connection with another human being? So then we need to enhance their connection, and that's more things like oxytocin, which is a chemical that gives us the feeling of love, of bonding, right? Um, and so it just kind of varies depending on where the person is, um, and also where the person is at that time in their life, if that makes any sense. Sometimes there's phases in people's lives where that's where they're at. But then there's other phases that the sympathetic tone is the one that is driving the car. So it's like, where we're at, I still want to regulate your nervous system so then the rest of your body is functioning at its best. I always tell people, think of the nervous system as like all the electrical wires that run the car. And if the electrical wires are sparking and like not making proper connections, organs are going to start giving us issues.
And with that, then do you support like the whole body, or do you
Yeah.
focus then on the
Yeah.
nervous
No,
system?
I started looking at what are some of those other physical symptoms that might be showing that there's an issue now with the immune system or their hormones. Lately, I've been working a lot with regulating people's hormones because at the end of the day, those are signals that are coming from the brain. So if I notice that now this anhedonic feelings and low energy feelings are being manifested because your hormones are dysregulated, because that happens a lot sometimes. The hormones get out of whack. And then we have to be like, okay, let's correct those. Because now that I'm looking at all your complaints and the issues that you're presenting, it's a hormone issue that is really kind of bringing us down, and we have to upregulate that. So it just kind of like depends which way we're gonna go. So
Mhm.
obviously I do extensive blood work, um, and specialty blood works too sometimes to see where are we hormone wise. Usually when there's anything else more complicated, or at least an area out of my scope, that's when I say, okay, let's work with this other provider who thinks like me, and they're also going to be in communication with me constantly because we got to look at your gut better. I'll start a little bit of the workup, but then I'm like, okay, let's continue to finish this with this doctor who works really well with the gut, or this other doctor that is really good with hormones, because I already reached the place where I think now we need to go to that person, you know? Um, but it starts with someone telling me, hey, I'm feeling like this or like that, and I have no idea why. It started suddenly, or it's been happening for years, and I've tried multiple things and things are not working. And I love to hear that because that's when I go into like, let's figure out this puzzle. And I like those cases, I like cases that are puzzles. And most of my patients, I tell them like, listen, we have to be realistic. We're not going to solve all these puzzle pieces in one shot, but we will, you know? Um, and when I hear that they're like, oh, I've tried all this and it's not working, I'm like, then it's not that.
Mhm.
And if we just keep looking in that direction, we're going to find the same things. So it's not that. Have we looked at this area? And most of the time they'll tell me, no, no one has checked that. Or no, no one has even brought that up to me. I'm like, well, I don't know. Now that I'm looking at all the things that you're telling me that you're having issues with, a lot of it is pointing towards a really bad gut. No one has looked at your gut? No. Okay, well, let's start looking at that. And then if I see something where I'm like, okay, let's go now to this person, then I refer. Um, but it's really looking at the entire person and not just the psychiatric symptoms, if that makes any sense.
Yeah, it's so important because like our brain is connected to our body, but like I'm a psychologist and in so much of
Mhm.
my training, it was just all about the mind. And there
Right.
was so little conversation about the body until after I finished my PhD and then I did my own training
Mhm.
on in that area. And it's all connected. Like we can't separate things out, can we?
Yeah. And isn't it funny though that like we're still being trained this way?
Hmm.
Like if these things are all separated, and or these things just don't, I think one of the things, I had a good conversation with a therapist a few months ago, where we were talking about how she was trained to call something this and I was trained to call it this, but it's the same thing, you know? So it's like people talking different languages, but they're all saying the same thing, And it's like if you really sit down and collaborate with another provider, you realize that you're both working on the same area with this person, which is calling it different things. But for whatever reason, we were taught that it was something completely different.
Hmm.
And it's like, no, our mind, our psyche lives in our brain. It doesn't live anywhere else. So it's like, how do we understand it more? And I think one of the beautiful things that has been happening in the last few decades is like we're having so much investment and research into what is the brain doing. What is it really doing? In psychiatry, we were taught it was just a bunch of neurotransmitters. No, it's not just that. And just like you, later in my own research and my own training, I realized that no, it's not just that, right? There's psychological stressors and psychological traumas and things that the person, records with their eyes and their brain and then saves it as a memory that could later trigger them in another time. So can you say that that was part of just a bunch of neurotransmitters communicating? No, it's a piece of it, but it's not the whole picture, you know?
Yeah. So for you, like what experiences or influences shaped you to practice this way? Because it is, like we started the conversation, it is quite different to the conventional way. So how did you get here?
I think it has to do with now, like everything, hindsight is in 2020, right? Um, I think the way that I got into medicine in the first place is what has allowed me to be thinking this way. I used to be a fashion photographer, and obviously I valued a lot of creativity and just free thinking, to come up with ideas and tap into other things in my mind that I didn't think were there when I was kind of producing a concept for a photo shoot or a campaign or something like that. So I kind of trained my brain without thinking that that's what I was going to be doing today, to think that way, to think creatively, to think outside the box, to question. And even while I was in residency, I would question my teachers so much about the DSM-5. And now, like I think the other day, they were mentioning I think it was the APA saying that they were um, kind of revamping the DSM-5 now to the next DSM-5. And it was funny because they put a DSM question mark. And I'm like, whoa, what? Are you getting rid of this thing? They kind of left it like that. It was a little bit of a teaser. But their whole thing now is like, we need to really look at it because we can't say that one person has five or six diagnoses or meets criteria for five or six of these diagnoses when they're all completely different. So they're kind of re-sitting down, reevaluating that whole diagnostic process in a more holistic approach. So I kind of, feel want to, message some of my teachers who are good friends of mine now and be like, you see, I was onto something. But I think that ability to question, the ability to think creatively has allowed me to work the way that I work today because I don't give up. Um, if I see that something comes back in one of my patients that is abnormal, I'm like, let's see, let's find out more. Um, and mainly because I had a personal thing that occurred with my dad where I did blood work for him a few years ago, and the only thing that was abnormal was his platelets. And this is someone who used to give blood left and right because his platelets were always very high. And he would donate blood because of his blood type. And I told my dad, that's kind of weird. Go to your primary care, see what they tell you. If not, I'll repeat the blood work again. And the blood and the PCP just kind of wrote him off. I was like, ah, that's not a big deal. It's a one-time thing. And I'm like, well, no, because if you knew your patient, you would know that that's not likely for him at all. And then when we repeated it, they were even lower. So then I pushed. I'm like, okay, go see an oncologist because that's abnormal. So I question every little thing. I double check, triple check. And he had a lymphoma. So if we would have just left it, and then funny thing is that now he's going through this type of treatment right now that is supposed to kind of get rid of it finally, but they only follow his platelet count. So it's like something that was probably at the time like very, not a big deal for his PCP. It's their marker to see improvement in the type of treatment he's getting now. So it's like, so it was something important to look at. So I really, with all my patients, I try not to just be like, oh, whatever, that's not a big deal. I was like, okay, well, let's not make it a big deal, but let's still find out if there is something there. If there's really nothing there, I'll tell you, listen, I've already exhausted all possibilities. We can watch it and we'll still repeat it if it's a blood value, but I don't discard things just because I think it's not a big deal. And I think that's something that needs to change in medicine altogether. Because you look at something like hormones, people would tell me like, oh, no, his that patient's testosterone levels are normal range. I'm like, yeah, but they're in a very low normal range. And he's having symptoms of low testosterone. And you're sending him to me because he has low energy, low motivation, low desire, that anhedonic kind of thing. He's tried multiple antidepressants, so it's not that. His brain is responding well to antidepressants. So what's keeping him so low? His testosterone. Then you fix his testosterone, he feels amazing. Take off all antidepressants. So it's like we need to be able to question more. So I've always kind of had that mindset or way of being that I just question everything. And I really think like, okay, what else could this be?
I think it's so important to have that curiosity and that creativity in any industry, but especially like what
Hmm.
you're doing because you are like solving like complicated puzzle pieces, right?
Hmm.
It's not always clear cut, it's often
No,
not. So it's so
it's never for
important.
me clear cut.
Right. And what do you recommend like in terms of testosterone? Like if somebody does have low testosterone, what do you help them with? Does it come back to all those lifestyle
Some of it is lifestyle, but let's face it, sometimes when someone has low T levels, they have no energy. So if you
yeah.
tell them like go work out to increase your testosterone, they're gonna look at you like, I don't have, I know, I'm not gonna do that. I don't have any energy. So I'm like, okay. So then what are some things that I can do to enhance his testosterone as much as possible, his or her testosterone? Because women too. So then I look at things like DHEA, which is a precursor. I look at boron. I look at ashwagandha, tungsten Ali, like all these supplements that have become now more widely used. And now we have more data to show that at least it can get people out of that hump at the beginning. Um, but then I got to start looking for causes. So I'll try to get them to like a better value so they can feel a little better. And then I got to start looking at causes. Well, why do we have low T levels in the first place? And you're this age, you shouldn't have low T levels.
And why is it that so many men and women are struggling with hormonal issues, like at a younger and younger age, like testosterone and other hormones? Like, what do you think's going
There's
on there?
been a lot of theories. I think one of the biggest ones is our nutrition, and the foods that we're consuming, that they're, quote unquote, loaded with hormones, and we don't really know really what they are. I think there's a lot of toxins that we're being exposed to, and um, but then also I think the pandemic and COVID actually has altered, because that has been one of the biggest. Now that we look back, and like we've obviously seen a huge decline in testosterone after 2020, and one of the biggest things that we had was being exposed to this virus that we know now has affected the nervous system, has affected the immune system, has affected brain function, and that's where testosterone ultimately comes from, right? It starts with the signals from the brain. So if we know that something like that has, or that time, has kind of taken us to looking at it a little bit more. So there's a lot of theories of why that's happening, but they're all kind of lining up to be major um, stressors on the body that have lower T levels literally across the board. But the biggest one is that they're believing to be is nutrition. So because you see, they compare US levels to other countries, and they're remarkably like way lower. So there's a lot to say about what we're consuming, and it's what we're consuming on a daily basis.
Yeah, the food is
Yeah. It's
it's not
not
what we
good.
should be. It's not
No,
food.
it's not food.
No.
It's not food for sure.
And with the nervous system, like what can people do, like who are listening? What are some things we can do in our day to day to help strengthen our resilience in our nervous system so we can just like get on with like the little things in life? I know like it's great to do like big um, like therapies and different things, but are there like
Mhm,
small
mhm.
things we can do? Like,
Yeah. The first thing I like, just to make sure we tackle the nutrition piece is like really sit down and get rid of anything that is inflammatory.
mm,
So start with, simple things that we already know are inflammatory. Sugar is very inflammatory to our nervous system, extremely. Okay. Our consumption of sugar has increased dramatically in the last 50, even more years by now. So start eliminating inflammatory foods, sugar, gluten, dairy. Just eliminate them for a little while, and you'll notice a huge change in your alertness, for example. One of the things that also we're dealing with is heightened levels of immune nervous system. So that sympathetic thing that I was telling you about. So as simple as meditation, prayer, okay, um, time alone to relax, like really relax, not turn on the phone, turn on the TV, look at a screen. No, no, really spend some time relaxing. Start with 15 minutes. Try to get yourself to 30 at least on a daily basis, and slow down. I think we're not realizing how much more effective we are if we actually slow down, and then we calm down our nervous system, because then now the part of my brain that is more logical can think things through better. It's going to start working better if we're just calmer.
mhm,
We're on this like kind of this rat race that we feel that we need to get to be more successful or more this or more that, when we need to just first chill out and enjoy some time with nothing, right? So if it's meditation, if it's prayer, if it's time for you to just to start your day, right? So these are things that I try to tell my patients, like start your day like this. If you notice that you have to catch yourself breathing, that's that sympathetic thing that I was telling you about. And most of us are like, you know, like breathe. And it's kind of some I was talking to someone about it the other day, and I'm like, I can't believe we have to talk about teaching people how to breathe. You know? But it's these simple things that at least get started with them. And then we move on to a little bit more complex things like regulating sleep, for example. Because if we're not sleeping well, you're going to feel horrible the next day. And then it keeps us in this cycle of then sleeping bad again, and then horrible, and then sleeping again. And then we stay on this like cycle that I've helped a lot of people get out of that cycle. Um, but it's those things that are small that are what I call the white butterfly effect. Make a small, deliberate, like thing that you can add to your day, to your month, to your year, to that is actually doable, that you could put into practice, that then we can see huge benefits down the line. Um, so I would say start with those.
Yeah, those are great to start with. And we really need to change that mindset in our society that like being
It's
slow is bad and it's lazy.
uh-huh.
Like there's just we're in this busy hustle culture, aren't we?
And then we feel that that's what gives us our value,
Hmm.
right? If I hustle, if I, work harder, that makes me more valuable to the company. Or if I am, the best at XYZ, then my spouse is going to love me more, or my kids are going to respect me more, or love me more. No, not really. That's a lie.
Yeah.
And for whatever reason, our society has taken that as true, as that's what gives us value. If we produce more, if we make more, if we do, you will be more successful. I mean, look at people like, Isaac Newton, Albert Einstein. They would spend hours just sitting around thinking and trying to solve the problem as opposed to doing anything, where we're being taught to like just get up and do something and then it'll come to you. No, that's not how the brain works. You have to actually sit in silence and in discomfort. It kind of goes back to what we started talking about. Sit in the discomfort and you'll find the solution to the problem or some way out, but you need to sit in it and
Mhm.
just be there for a little while. And if it doesn't happen today, do it again tomorrow. That's that discipline piece that I've been trying to teach a lot of my patients.
Yeah, I love that. So your clinic is called the White Butterfly Clinic, and you mentioned white butterfly there. What is the significance of this name?
So the white butterfly, it comes from this statue that I saw at the Louvre. It was actually right before the pandemic. It was February of 2020. We had gone to Paris, and I love going to Paris. It's one of my favorite cities in the world. And we went to the Louvre, and there was a statue in the corner, and it was Cupid kissing a girl. And I thought it was so beautiful. And I took a million pictures of it and angles. And I don't know why I was really captivated by this statue. And I got home, I went to study it because I like Greek mythology so much. And I learned that the girl's name is Psyche, and she's known as the white butterfly. So I was like, okay, that's kind of cool. So Psyche, like psychic, um, and it's no, it means the word psyche means soul, means mind, and then the word psychiatry is the medical treatment of the soul, which is psychology is the study of the soul, right? So to me, it was kind of like, well, that's really cool and like just romantic and like just beautiful. Like in my photographer mind was like thinking of like images and all that stuff. I'm like, this is perfect. And I'm like, that's what I'm gonna name my practice, the white butterfly. And it's funny because sometimes I'll get people ask me like, oh, you like butterflies? I'm like, no, I like Psyche and Cupid and the whole story. And then once I tell them, they're like, oh, well, that makes sense.
Yeah, it's very
So that's
cool.
where that came that where that originated.
And you do a lot of like work with people like in group settings, and you're really an
Yeah,
advocate for like healing in community, and you run retreats. Is that correct?
correct.
Why is that? Like, why is healing in community so important, especially like nowadays with everybody living at home and working at home and doing everything by themselves?
Well, first of all, I think we heal best in groups.
Mm.
We heal best when we have support systems. And what are support systems if not families, friends, whatever you want to call it, but they're groups, right? So every study that I have read where people really do heal, right? Not just get better, but heal from those wounds that I was telling you about. There's always some kind of connection with a group, right? Whether it's AA, whether it is group therapy sessions, right? At the end of the day, we come to groups. We're social creatures. For whatever reason, our brain has been wired to behave and function better in creating groups. So to me, it was no brainer to start doing that kind of implementation in my practice. So one way that I did that was with retreats. I think retreats have a weird, and I use the word weird, it's a weird, powerful thing that occurs. Because if you've never been to one, you don't know what I'm talking about. Until you do, then you're like, oh yeah, that was like this weird, amazing feeling that I had. But it was because we were in community with someone. And then I just love how social media tries to steal that concept because then, you hear content creators will say like, oh, join the community or join my community. It's like, it's a false sense of community in my belief. I think community has to occur in person. I think social media and us right now being able to do this conversation through Zoom is great. I mean, that's a huge benefit. However, there's a lot to say when it comes to like physical, presence with another person and another group of people. So we created the retreats all around the themes or the pillars of the what the white butterfly stands for. So actually, this weekend coming up, we're going to Cancun. It's our first retreat of the year, and it's titled The Discipline Formula. And it's all about how do we train our nervous system to be more disciplined in all areas of my life, whether it's my love life, whether it is my work life, my personal life, like with myself. And it's going to be me, an amazing psychotherapist that I know, who's a trauma expert. She's going to be coming, and one of our coaches, one of our life coaches, is also going to be leading it with us. And then we have this amazing woman. She's so awesome. She's a sound healer and she does yoga. She's also going to be coming as us four are kind of leading the retreat. But the retreats, I always tell my patients, is not to escape, right? It's not to put pause on my real life and I get away. There are some aspects of the retreat where we're kind of getting away. There's massages, there's rituals that we're going to be doing. They're like Mayan inspired rituals because we're going to be in the Riviera Maya in Mexico. Um, but the whole intention of the retreat is to get started, right? We're going to go to this retreat to get away, but we're going to get started on something. So if it's confidence, if it's discipline, if it's curiosity that we're having an issue with, now we're going to get started. We're going to go away. We're going to kind of see the big picture, look at the whole plan for the whole year, and work on this area of my life. A lot of the people that are going are actually couples. So our focus has turned into, okay, let's put discipline when it comes to my relationship with my significant other. So we always, we have the main theme, but then we see who goes, and then who goes, then we kind of still tailor it towards what are that group's needs. And then we also have the ability, thank God, with the people that I work with, that we're always very open to spontaneity and see what the group, this specific group wants to share and wants to work on. So then we kind of alter it. And then the other thing that we do is we're gonna have it's kind of like think of it like a panel. So the four leaders of the retreat will meet with every person individually, one on one, to put together a plan for the next 6 months, 12 months.
That sounds incredible. And do you tend to have the same people come back throughout the year to like the different
Yeah,
like
they do.
discipline,
Yeah,
confidence?
they do. They really do. Mainly because they like how we do it. They know that it's not just to get away and feel relaxed. Um, I've had a few patients that will go to some retreats and they're like, "Oh, this is for substance use, so we'll be sober." But then they'll come back to their life and whatever they learn in the retreat kind of become harder to actually implement because it wasn't incorporated or it wasn't thought out to be put into now the stressors of real life, which I think that's one of the biggest keys that our retreats have is that how can I Everything that we're going to be teaching you is going to be amazing. You're going to feel empowered, but let's put it into practice, practical, tangible things and steps that I can put in place. And then there's also accountability times throughout the next 3 months and 6 months where we meet with each individual, whether it's through Zoom or through or in person, depending if they're in our city, to kind of check in. Hey, the things that we worked on that we said we were going to do, where are you in this area?
Yeah, I think that integration piece is so important, and retreats can be amazing because you're like just in it and you're immersed in it and you're in a different environment. So you're more open to trying
Hmm.
something new. But then having
Hmm.
that integration of bringing that into your life is where the change really happens, isn't it?
Yeah, yeah, and that's where we've really seen that people why they come back because they're like, I really tackled this area and it worked. Like I saw results. I want it again.
Mm.
But now in this area that you're talking about, like, I kind of want that. But you always have new people, which is great. Most of the people actually that are coming on this one or most of them are new into the retreats that we do. So it's kind of exciting. And then the other wonderful thing is that we get to have the whole hotel by ourselves. The hotel that we're using the grounds. They're designed to be more of an intimate kind of thing. So it's really nice because then everyone is going to be individually tailored. So it's a whole different like level of retreat. Sometimes you go to a place and there's like a bunch of other people that have nothing to do with you, and you're just kind of like, okay.
Yeah, it sounds amazing. Was there anything that you wanted to mention here or you think would be important for listeners to know that like I didn't ask or that we haven't talked about yet?
I guess our magazine. So our magazine is something that I started to publish last year, around springtime. And it all came from an idea of one of my patients. He's actually going on the retreat with his wife this weekend, which I'm so excited about, for them. They're doing so good. But I used to write for my patients newsletters. And they were like, I thought they were really beautiful because I would design them just like how I used to do it when I was a photographer, for magazines and stuff. And he replied to me one day, he's like, Doc, I had to tell you that I love your magazine. It's so beautiful. It's so put together. He works in something that has to do a little bit with like imaging and images and things like that. So he was like really impressed because I was like, you're a psychiatrist. I didn't know you did that. And I'm like, well, thank you. I appreciate it, but it's not a magazine. It's just a newsletter. It's an email. It's not a magazine, right? But that's what's kind of sparked my creativity to be like, wait, I can do a magazine. I'm like, I used to do that for some of the magazines that I used to work for and produce campaigns for. So it's like, why don't I do one? So I did my research. I started looking into like what's out there, what's not out there. A lot of people obviously told me, well, magazines are dead. People don't read magazines anymore. I'm like, okay, so I'm gonna do it anyways. Um, but then the way that we put together the magazine is on these pillars of like there's like the discipline issue, the curiosity issue, the integrity issue. The one that we just published is our first confidence issue because last year I didn't do the confidence issue. Um, and then this year is the first time that we're also going to do it in Spanish too. So the magazine is in Spanish. So it's really exciting. There's a lot of information there about how we can learn to be XYZ, whether it's discipline or confidence, and how does my body, how does my nervous system do these things. But then there's also like I'll invite different providers that write and feel that they want to contribute. So they have a section that I called In Good Hands. So it's like in good hands with so and so, and then they'll give their perspective or they'll teach us on how they see confidence, whatever it is. And then in there, I have like a little sneak peek of my Power Up series, which is a series of workbooks that I put together also on these areas, but more of a workbook kind of thing where people can get it going and work on it. So it's really, really exciting. For example, last year, the integrity issue was more focused on women, and how we can be in aligned with ourselves, and how is it that the the female brain behaves when they feel that there is integrity in someone or vice versa. So then this year I'm going to focus on the male brain and how does the male brain identify integrity, and how do they feel towards loyalty and things like that. So it's a fun side thing that I do, but I think the reason why I did the magazine specifically is because it's a free resource for people who want to learn more about what we do at the White Butterfly, but maybe they haven't, said, okay, this is something that I want to do, that I want to take care of, but let me read about it. That's one of the reasons why I put it together.
I love that. I personally love magazines. I think it's great that you're bringing them back, right?
Yeah,
I'm
yeah.
so sick of like social media and things. I mean, I use it plenty, but it's nice to have like magazines. It's something different,
I
right? And
know.
it's more you're more invested in it.
Yeah, and it's not a website. Because I think a lot of the magazines, one of the reasons why a lot of them kind of, and I'm talking about specifically the fashion magazines, they went to websites, is because people, that's where they went to, right? They stopped buying the physical thing. But I think in life, everything is a pendulum. Things come back and forth. And I think now you're seeing more of a rise. When I go out to events and networking and stuff, I don't give out my business card. I give out the magazine. I'm like, well, this is my business card, and people love just touching the magazine and then they look through it. And it's funny because you see them like if it's this new thing, I'm like, no, magazines have been around for for like, I don't know, not hundreds of years, but a long time. This is not nothing new, I actually have here, let me show you. I actually have a few of them here, you see.
Oh yeah, they're beautiful.
Yeah.
Wow.
So it's
Yeah.
like it's funny to like have them like look through it. And this was actually one of our popular one, the discipline issue. Um, so I did it like discipline, but looking at discipline as like the ugly part of starting and getting to something. It's discipline. When we say I want to do something that's motivational, once I get to the end of it, then I get accomplishment. But it's the ugly middle. It's the that's why I put like a tiger and he's like a little bit scarred up and beaten up, because he's working, right? He's working on being a good fighter. But that's the hard part. And then one of the issues is called sweat and tears. So I talk about basically that is like looking ugly in the process. And that's okay because that means you're disciplined and you're going through it, whether it's sweat and tears, but you're getting through it. And we don't look that cute when we're exercising.
I'm gonna have to read that. I think, yeah,
Yeah.
we like disciplines come up a number of times in this conversation, and I think it is
Mhm.
something that so many of us are lacking in this day and age is
Mhm.
sticking with things and having that
Right.
discipline. So
Right.
I'm looking forward to reading that one.
I
All
would
of
love
them,
your
actually.
feedback.
Yeah. Yeah. My husband keeps talking to my kids about like how we have integrity and he's teaching them integrity. So
Yeah. And they
definitely
look at
check
us
out that
like,
one.
huh? What is
Yeah.
that?
I just need to get them the magazine and someday they'll figure it out.
Yeah,
So
exactly.
where can people like find out, like where can people actually get the magazine and find out about your retreats and work with you?
Yeah, so in our website is called the whitebutterflyclinic.com or whitebutterflyclinic.com. The magazine is in there. It's free. So if you go on resources and click on mag, they're all in there.
Okay.
At least the PDF versions of them. And then the print version, I usually have them and I'll send them out depending on people want them physical copies. The retreats are also in there under events. So everything is on our website.
Okay.
And they can always kind of reach us through there.
And your socials, I'll put everything in the show notes, but just in case people are listening and not looking at show notes, what is your socials handle?
Yeah, so the social, I usually tend to use Dr. underscore Hector. That's my Instagram and a lot of the stuff, my YouTube channel and Facebook. And then the clinic is White Butterfly Clinic, but all one word.
Okay, amazing. Well, thank you so much. I just absolutely love what you're doing with psychiatry. I think it's so important. And I love your really holistic view of it, not only in how you approach patients, but also like you are doing the retreats and you're doing the magazine, like you're working holistically yourself. And I think that's just, yeah, it's so incredible. It's very inspiring.
Thank you. I can't do it any other way, honestly. Like even
Well,
if I
don't.
try to, I'm like, I can't. Like I have to do the whole thing. So
Well, thank you so much.
thank you. Thank you.